Have you ever wondered what actually happens inside your body every time you drink alcohol? Whether it's celebrating with friends, watching the World Cup, or relaxing after a long week, alcohol is a common part of many people's lives. But behind the scenes, one incredible organ is doing almost all the work: your liver. The liver is your body's natural filtration system. Every drink you consume places another task on this remarkable organ. While your liver is incredibly resilient, even capable of regenerating itself, it also has its limits. Today, we're going to explore the fascinating relationship between alcohol and the liver. We'll discuss what your liver actually does, how alcohol is processed, what happens with occasional versus heavy drinking, the warning signs of liver damage, and perhaps most importantly, how your liver can recover when given the opportunity. Let's dive in. Before understanding alcohol's effects, it's important to appreciate just how amazing your liver really is. This crucial organ performs more than 500 different jobs every single day. It filters toxins from your bloodstream. It processes nutrients from the food you eat. It stores vitamins and minerals. It produces proteins your body needs. It helps regulate blood sugar. It manufactures bile, which helps digest fats. And perhaps most importantly for today's discussion, it breaks down alcohol. Unlike many nutrients that are used throughout your body, alcohol is treated differently. Your body views alcohol as a toxin and prioritizes removing it as quickly as possible. That means every time you drink, your liver immediately shifts much of its attention toward processing alcohol before handling many of its other important responsibilities. When alcohol enters your bloodstream, it travels directly to your liver. Special enzymes begin breaking alcohol into smaller compounds so your body can eliminate it. The problem? Your liver can only process a limited amount of alcohol each hour. If you drink faster than your liver can metabolize it, alcohol begins accumulating throughout your bloodstream, affecting your brain, heart, muscles, and nearly every organ system. Over time, the repeated breakdown of alcohol creates toxic byproducts that can injure liver cells. Initially, your liver often handles this damage surprisingly well. Because liver cells can regenerate, occasional damage may be repaired. However, repeated heavy drinking eventually overwhelms the liver's ability to heal itself. That's when problems begin. Instead of healthy tissue regenerating, inflammation develops. Eventually, scar tissue can replace healthy liver tissue. And unlike healthy liver cells, scar tissue cannot perform the liver's critical functions. One of the most important things to understand is that liver damage usually develops gradually. It doesn't happen overnight. Stage 1. Fatty liver. The earliest stage is called alcoholic fatty liver. Fat begins accumulating inside liver cells. The encouraging news: at the stage we're currently in, the condition is often reversible if alcohol consumption stops. Many people experience few or no symptoms during this stage. That's why it's so easy for fatty liver to go unnoticed. Stage 2. Alcohol-related hepatitis. If heavy drinking continues, inflammation develops. This condition is known as alcohol-related hepatitis. Despite its name, hepatitis simply means inflammation of the liver. Symptoms may include fatigue, abdominal pain, nausea, fever, yellowing of the skin or eyes, known as jaundice. More severe cases can become life-threatening. Northwestern medicine notes that patients with acute alcohol-related hepatitis who continue drinking face an extremely poor prognosis. However, some people who completely stop drinking can see substantial liver recovery after several months of sobriety. Stage 3. Fibrosis and cirrhosis. Continued inflammation causes scar tissue to develop. If enough scar tissue accumulates, it progresses to cirrhosis. Cirrhosis permanently changes the structure of the liver. Blood can no longer flow normally through the organ. The liver struggles to perform its essential jobs. Unfortunately, advanced cirrhosis cannot simply be reversed. Treatment focuses on slowing progression and preventing complications. In severe cases, transplantation may become necessary. One of the biggest challenges with liver disease is that symptoms often appear only after significant damage has occurred. Some warning signs include yellowing of the eyes or skin, swelling in the abdomen caused by fluid buildup, called ascites. Also, persistent fatigue, confusion or difficulty thinking clearly, easy bruising, loss of appetite, and nausea. Northwestern medicine explains that confusion can occur because a damaged liver struggles to remove toxins, such as ammonia, from the bloodstream. When these toxins build up, they begin affecting brain function. Here's the encouraging part. The liver is one of the only organs in the human body capable of remarkable regeneration. If damage is caught early enough, stopping alcohol consumption often allows the liver to repair itself. Fat accumulation can decrease, inflammation may improve, liver function can recover significantly. However, once extensive scar tissue develops, complete recovery becomes much more difficult. That's why early intervention is so important. The sooner someone reduces or eliminates excessive alcohol intake, the greater the opportunity for healing. According to Northwestern medicine, abstaining from alcohol is essential for people with alcohol-associated liver disease and cirrhosis, because there is no safe amount of alcohol for them to consume. Protecting your liver is a process. It's about consistent, healthy habits. Some of the best ways to support liver health include drinking alcohol responsibly or avoiding it altogether if advised by your healthcare provider. Maintaining a healthy body weight. Eating a balanced diet rich in fruits, vegetables, lean protein, and whole grains. Exercising regularly. Staying hydrated. Avoiding unnecessary medications or supplements that may stress the liver. You may even choose to incorporate natural support supplements like lymph tonic, which helps to support the lymphatic system. If you're concerned about your drinking habits, remember that help is available. Northwestern medicine emphasizes that treating alcohol-related liver disease often goes hand in hand with treating alcohol use disorder through counseling, medication when appropriate, support groups, and behavioral therapy. Your liver quietly works around the clock, asking for very little while doing an enormous amount for your health. Every drink you consume is processed by this incredible organ. And while it has an impressive ability to recover, that ability isn't unlimited. Understanding how alcohol affects the liver gives us the opportunity to make informed decisions, not out of fear, but out of respect for one of the hardest working organs in the human body. Whether you choose to drink occasionally, reduce your alcohol intake, or avoid alcohol altogether, supporting your liver through healthy lifestyle choices can have lasting benefits for your overall health. If you found this video helpful, be sure to like, subscribe, and share it with someone who may benefit from learning more about liver health. To try Lymph Tonic, click the link in the video description. Thanks for watching, and we'll see you in the next video.